My name is Domingue. I'm going to present on abutment selection for single tooth and partial arch reconstruction, intraoral scanning. Most of this is for the MegaGen Any-Ridge implant system line, but it can be used with really any implant system line. I'm just going to show you what I personally use. You can follow me on Instagram at Implant Diplomat or Louisiana Dental Implant Lab. Louisiana Dental Implant Lab has made all of the restorative cases for this, and they've been a big help. Also, YouTube channel with other videos that you can check out if you need anything. I'm a general dentist practicing in Lafayette, Louisiana. I'm a 50-50 partner with Jerome Smith. I do own and operate Louisiana Dental Implant Lab, where we currently, as of mid-2023, work with 250 dentists. We developed a vortex screw in the lab, and Corey, Glenn, and I run Digital Dental Masters program, and I own and operate the Mission Smile Foundation, which is a nonprofit organization. So let's jump into custom abutments for MegaGen Any-Ridge, and what you'll see here is the 3-3 normal, or the default custom abutment for a MegaGen system. But there also is a tie base, which we're going to review for Zirconia abutments, and then there's this green S2, which is a wider platform abutment. We'll look into that too. Essentially what you really need to know is for MegaGen Any-Ridge system specifically, only use OEM parts. I've had issues, other dentists have had issues, and I know lots of friends have had issues with third-party parts. Their conical connection is significantly deep, and their abutments have this internal thread inside the abutment to be able to remove the abutments, and that's a deep conical connection. It's hard to duplicate this with third-party parts, and I've had tremendous issues, and MegaGen's facing lots of problems for support for their doctors whenever they use third-party parts. So just be mindful whenever you're using your lab, make sure they use OEM. So to review, there's 3 main custom abutments. The 3.3, which is the default or the most commonly used one, and then not that long ago they developed the 4-core and the 4.8 core custom abutments. Now this is going to be used for molars, but you can see the platform is wider from the 3.3 to the 4, and from the 4 to the 4.8. This is the widest, right? And we'll review when these are going to need to be used. But to be mindful, there's actually one more abutment that doesn't get utilized all that often. These abutments just came out of the machine. They're for some patients. This is the 3.3 that I just showed you. This is the 4-core that I just showed you. This is the 4.8 core. So those are the most common ones. But they also make a 3.3 extra easy. And do you see how it has this like lip right here? And it looks larger than this 3.3. We'll go over how to utilize that. So just know that there's really 4 abutment types. But the nice part about this system, when you're scanning, you're only using one scan body for all the different, for every single platform. Like, you can use this scan body and you can order any one of these abutments. It doesn't matter. You can change your mind at the last minute. You don't have to get the patient back. So for all of your scanning, I typically use the 13mm height scan abutment. Every once in a while I'll use a scan healing abutment, which is really nice. And we'll go over so this is the healing abutment, and this scan post sits on top of it. With every implant that I expose and I place in this scan abutment, I'll always take an x-ray to confirm the seat, or my dental assistant take an x-ray. 2 ways to look to make sure it's seated. You look for this angle right here to be fully flush with the base, and you also look for the screw. You want to make sure that there's no holes right here. If there's a gray area, then it's not fully seated, right? So what we'll do is we'll take PAs to make sure this is fully seated. So there's like a little tiny little black thing, and this is fully seated here, then we're good to go. So for scanning for anterior cases, I always like to scan the opposite arch, and we'll take 2 bites. If I want to mirror image the opposite tooth, so tooth number 10, I'll scan at least up to tooth number 10 plus 1 tooth, and I'll take a bite on this side, and I'll take a bite on the opposite side. So I have, this is a bite right here, and this is a second bite. You can see from the occlusal view. And I'll take a full lower scan, or I'll take an ipsilateral or a matching scan of the lower arch. So if I scan up to the canine number 11, I'll scan from 22 all the way back to 18. It just helps the lab mount the case a little bit better and prevents any issues. That was actually my case in my office. The day of scan, I realized that we didn't scan the opposite tooth plus one. So in this particular case, this patient is going to have a tooth that might not mimic the opposite side. So I highly recommend not doing this. You can see how we typically try to follow through past this implant, but also try to capture the tooth on this side plus one. On the form that we fill out, this is just a Louisiana Implant Lab form. We'll put the patient's name, what we're ordering. We also add the sticker for the case to the lab, just in case they have any questions. So this is a 3.5 implant with a 2.8 core and 11 millimeter height, which really doesn't matter. Really what matters is this core size is really important, and the 3.5. And we'll order a zirconia abutment, and we use a 13 millimeter scan body that you just saw. And then so from this scan body, you can order the 3.3, the 3.3 extra easy for this particular case. Those are your two options. Now you can't order a 4 or 4.8 core, and the lab will know that. If you want to get this lab script, you just take an image of this and it'll get you to the website to be able to get the lab script. What about for the other scan body that we reviewed, the scan healing abutment? Now, I like using these a great deal, always confirming with an x-ray to make sure it's fully seated on the platform. This is what it looks like fully seated. Understand that there's 3 different heights, and the heights are the most important thing. This is what you need to tell your lab. Are you using the yellow 4, the gray 5, or the green 7? So you'll scan this scan healing abutment, and then you'll snap this cap on top and scan the snap cap. And this white part is actually what you really want to capture. But it gives you an idea of the profile of the tissues with these, and I'll explain that in just a second. They also make a extra type. I don't recommend using these. It just gets really confusing for your staff. I would just stick to the what we have in our office are just the 5 and the 7s. That's all we have. It keeps things simple. And okay, so again, there's heights 4, 5, 7, which is this 4, 5, 7, and there's also profile diameters. This is where it gets confusing for most staff, and I just said it wrong. But there's a 4 diameter, a 5 diameter, a 6 diameter, and a 7 diameter for each one of these, the 4, 5, 7, 4, 5, 7. Here's what I'm going to recommend. Don't order the 4s, only order the 5s and the 7s. Those are the most commonly used one, because you're going to be placing these implants subcrestal, so it's a deep conical connection. And if it's really deep, you're going to use a 7, and if it's not so deep, you'll probably use the 5. More so in the posterior. What diameter I like the most? I usually use the 7 millimeter diameter for molars and the 5 millimeter diameter for bicuspids. And I usually only use them in the anterior or the posterior. I never use them in the anterior. So if I was going to order, I would order the 5s and the 7s, and I would order for the 7, I'd order the 5 and the 7 millimeter heights. So you're going to have a 7 millimeter diameter for the 7, and you're going to have a 5 millimeter height with a 7 millimeter diameter. And I do the same thing for the 5s. Those are the most commonly used ones. And for the scan healing abutments, what you want to do is expose the implants, screw in these scan healing abutments, and capture them. Sometimes whenever you're scanning, it'll get lost in soft tissue, and obviously you don't want that. So I put these in first and then scan the patient's tissues. What you can see is the numbers on the top of these scan healing caps. So after you scan the scan healing abutments, you have to snap on these little white caps, and you can see 5, 6. That's the diameter of these things. You don't need to tell the lab the diameter, you just need to tell the lab the height. The diameter is used by the lab so they can create the profile of the soft tissue, because they know that this is a 6 millimeter diameter, so they can get a proper emergence profile for your abutments. Now it's important not to double scan these cases, right? So right here you can see that there's a lip and another lip. This looks like there's a little bit of a double scan on this, which it looks completely different from this one that's super crisp. Just be mindful of that. Now I'm going to show you a little bit of a case that we did not that long ago. And we scanned, and it's a case for an upper arch. I'm going to let that load here in a second. And again, for these cases, you basically do the same thing. You order the type, abutment, zirconia, crown, abutment type, whatever you want. And then in this area for the scan body, you're going to put scan healing abutment and tell your dental assistants to put the height only. Oftentimes what we'll see is patients or staff members will put like 5 by 7, which means 5 millimeter diameter by 7 millimeters. But you don't need to do that. Just tell them to put the height only. And after they put the height, then they just have to order 3.3 standard, 4 core, 4.8 core. You can order whatever you want those scan bodies there. And then if you want to put a sticker, that helps out the lab. So here's the different implants. And before we jump into this, let me show you this case. So this is the case I was just telling you about. Let's go to the maxilla first. So for this patient, when you're scanning across the arch, you'll stop right here. This long span is difficult for scanners to pick up on soft tissue and not have overlapping. So I'll place the scan healing abutments inside, and I'll scan over them. You see how they're gray? So already the lab knows that these are probably 5 millimeter height, right? And then you scan the soft tissues like this with those scan healing abutments in place, and then you snap on the snap caps, and then scan that, and that's your reference for the implant position. All right, same thing with the lower. So you can see I just exposed this one. So we'll scan the scan healing abutments, and then we'll come back after to scan these little white peak material, and that's the implant position. So really, after we take these out, the patient just leaves with the scan healing abutments in place. That's their healing abutment until they come back for their final restoration. Let's get back to our PowerPoint and review the different types. So the 3.5 millimeter implant I typically use in the anterior, never in the posterior, mostly for laterals. It's got a 2.8 core. This is the only implant you can use to order a 3.3 extra easy. That's it. This extra easy only goes with 3.5. Now the default is a 3.3. So this is the core size of these implants. Again, same scan body across all of their implants. You can order whatever you want. The 3.3 default is you can use from the 4.0 core, the 4.0, the 4.5, the 5.0, the 5.5, the 6, the 3.5. You can use this for everything. The 3.3. I typically use it for this size implant for anterior and bicuspids. The 4.5 for the bicuspids and the 4.5 for centrals, and the 4.0 for laterals if needed. And I'll order a 3.3 core custom abutment for these implants, because that's your only option, really. You can't order 4 cores. Now when you get into larger sizes like the 5.0 and above, you can start ordering the green S2 4-core abutments. Now you see the 5.0 implant has a 4.3 core, so you can go down to a 4.0 core. You can't go up to a 4.8. That doesn't make sense, and I'll show you that later on. Once you get into the 5.5 and above, you can start ordering the 4.8 cores, as long as that's the core of the implant. I typically only use the 4.8 cores for bruxers, or if I have an implant that's 6.5 and greater. For molars, I'll use I'll start out at a 5.0 core. So I hope this little diagram helps, and I'll show you another diagram in a second. But overall, for intraoral scanning, what you need to know for anterior and posterior, it's a little bit different. Anterior scans, you always have to cross the arch for the ipsilateral tooth +1. Always scan 2 bites. so it can be remounted by the lab. I typically develop the soft tissue and scan after I wait, and wait 2 weeks for best results. If it's not a high aesthetic case, the patient doesn't care, then I don't wait. I'll have a second scan as an abutment. So my first scan is the soft tissues, how I develop the soft tissues, and then the second scan is a scan body. So if you have a good provisional, let's scan the provisional, or if you don't have a good provisional, if you have a pre-op scan of the patient that was taken before you extracted the tooth, it's really important to send that to the lab because they could actually go off of that design to make the profile for the final crown. In the posterior for singles, always get 2 bites. I still do it. Scan tissue first and the abutment second if the software allows to do that. That's what I do. Scan your healing abutment for kidney class. So those scan healing abutments I use for kidney class 1 patients that I showed you, partially edentulous. And then subcrestal placement of your implants is typical for this implant system since it's internal conical connection. That's why I use a 13 millimeter for most of my scan bodies. All right, let's talk about zirconia anterior on tie bases. All right, I got this graphic off of the internet, but essentially it shows how as the soft tissue develops, you're going to want the tie base to increase in height. Well, the same is true if the abutment is placed subcrestal. So this is a platform matching implant. But if you have a platform switched implant, you're going to place it below the bone, and you want to develop, you don't want the zirconia going all the way down to the platform, but you want to develop you want to have a nice connection of your tie base inside the deep conical connection subcrestal, and you want the tie base to be developed above the bone and above the soft tissues. So MegaGen's line is such that it provides, and you see how this height is the same throughout all of them, where MegaGen's line does not. They have 6 options for the 3.3 and 3.3 extra easy, and they have 6 options for 4 and 4A core. So they have 24 tie base options to use to restore your cases. For you, this is great because it gives you more options to get the best prosthetic platform. For labs, it's not ideal because they have to carry such a heavy inventory of tie bases. Ideally, they just have 1 or 2, but that's not the case with MegaGen. So this is a plus for the dentist, a negative for the lab. But if you own your own lab, you're gonna have to suck it up and have a heavy supply. If you don't, just use a lab that uses OEM tie bases, because this is where labs cheat the most, is on tie bases. They use third-party parts. So just know that there's a 3 and a 3.3 extra easy for these tie bases, and a 4 and a 4.8 core for their tie bases. So you can order a wider core tie base for molars, and I'll show you that in a second. But again, like I said, most systems, this is a third-party part system, this is a short and a tall, right? And this is their only 2 options for these cases. And you can see the way there's zirconia seats on it, it's the same for both of them. So what if you had this case where it was deep conical connection and your platform stopped right here and then you were coming with zirconia? I wouldn't want that. Or you see how this flare tapers too much here? It's going to hit on the walls of the bone, and this tie base won't ever seat, and it will be a problem, or you'll have some bone dieback. This is a deep conical connection implant, and having the variety of all these tie bases really does help out. Or what if you have one implant that's higher than this implant, right? This was a large bone defect, and this is my case. I placed an implant in 8 and 10, which I don't like to do because it gets a little bit more difficult prosthetically. But because they have such a nice array of tie bases, we're able to use a short one here and a long one here. So she went from this, we took out her 4 teeth. These 2 had internal resorption. Our 3 teeth had internal resorption, and we did an implant in the central and an implant in the lateral position. I think this just had a lot of infection and bone loss. This is the day of delivery. These are just provisional. She's going back to her restorative doctor for the final crowns. This was delivered like this week, so before and after for her case. But not all of them are that deep. right? So a case where you're doing 2 central incisors, sometimes it's really difficult to develop the soft tissue. You can see I usually develop them in provisionals before I go to finals. These are 2 abutments in place, and you can see since it's the same height placement, they're going to get the same tie base. And I'm moving this connection between the titanium and the zirconia just above the bone, and then developing the zirconia within the soft tissue. So this is the MegaGen's profile versus a third-party part. You see how this is much shorter than this MegaGen? And this is MegaGen's shortest one, I believe. And even still on this one, I think it's a little bit too short because this platform should be a little bit further or higher up. But this is typical for a third-party part. So we've talked about the 3.3. Let's look at the 3.3 Extra Easy. The Extra Easy is only used for the 3.5 millimeter implant with a 2.8 core. And this is the platform shift, right? This is the platform matching. So the 3.3 Extra Easy actually converts your 3.5 implant into a platform matched implant. So placing these subcrestal is not ideal because you'll have remodeling of bone. Just know that. If you want to have a platform switched implant, then don't order a 3.3 Extra Easy. If you need the strength of this, then order the Extra Easy. So this is more built for strength than anything. So why would you order a 3.3 Extra Easy? What you need to understand is this diameter of this retentive screw is 2 millimeters. The threads in this screw are 1.8 millimeters that go inside the connection of the implant, right? But the outer diameter of this implant is only 3.3. That's the 3.3 core. Right here is 3.3. So the diameter of this titanium circumferentially around here is 1.3 millimeters of diameter. Now, this is the same implant. So this is a 3.5, this is a 3.5. But this is the platform switch 3.3. This is the 3.3 Extra Easy. So the extra is that holds that lip down. So if it's a 3.3 diameter titanium, you're getting a 1.6 radius. So this is 0.65 millimeters of titanium. And if that's too much, it might flower a fracture, right? And so order what you need for your patient, depending on the patient. Now, I have had patients in the past that have really tight bites, and what I've made for them is this is actually a full contoured custom titanium abutment that the Louisiana Implant Lab will mill, and then on the top of it they'll mill this zirconia coping on top, and then it's a zirconia abutment, right? So that for this particular patient, you can see the depth of placement is fine, but I didn't have a lot of room to develop this crown because of his bite was so tight. Now, he actually had issues, that's why his tooth fractured. His bite was so tight, eventually this tooth fractured. Put the implant at a nice depth. We developed the soft tissue, but this is a full contoured titanium abutment with a zirconia coping, and I did that for strength for this patient, again, because he has a tight bite. All right. Finally, just to drive home the message, this is a third-party part. This is a third-party part, and this is a third-party part. And you can see how third-party parts are typically 1 or 2. They have very short tie bases, and the issue with this is fretting. You're not getting a really good bond of the zirconia to this tie base, and it'll loosen up over time. Also, I don't like my platform of the zirconia to the titanium that deep inside. I like it to draw it out a good bit, so I'd prefer to have my tie base platform here, my tie base platform here, fully developed like I show you. This is also a mini case that I got back from a design. It's way too deep, and the zirconia is developing from here, so I want this platform to be raised up and then develop my zirconia. Let's talk about zirconia RC bases, because it's a new thing coming out from MegaGen. There's really 3. There's 0, there's 11, and I think there's a 22 degree, it might be an 18 degree tie base. So these are angled tie bases. Why is that important? So traditionally, you get a tie base that just goes straight. But these RC bases will be able to angulate 11 degrees off-axis angulation to be able to screw retain a crown. Very important to note that the max torque on these is 15 Newton centimeters. Let's look at a case, and we did this recently. Now these are coming out through FDA, but I wanted to show it in this case. I actually wanted to order a screw retain crown for this case, but the screw access holes come in from through the incisal edge. It won't work. But if you use an 11 degree RC base, you can actually change the angulation of the screw access hole. You can see you can go from here to here. This is an 11 degree tie base, so you can still get a full contoured screw retain crown for this case, and it kind of looks like this. So as you screw in this, it uses a ball-in T5 Torx driver, which is the same size driver as the Vortex driver. Again, the max torque on both the Vortex screws and this screw is 50 Newton centimeters. So it's a double threaded screw for these abutments. As you screw in this interface here, as this tightens this abutment, it binds into the implant and they kind of wedge each other together. So you only need 15 Newton centimeters of force. It's not a butt joint. They're actually wedging each other down together. All right, let's talk about zirconia in the posterior. So in the posterior, I'm recommending the 4 or the 4.8 core for your cases. Let's look at some cases. So first of all, height's important, right? I don't want the tie bases there. I want to develop the titanium a little bit more before I go into a screw retain crown like this. And also like this case, I got this web view back and I asked for a taller tie base, which we're going for here. But you see that these dentists are only ordering 3.3 cores, which I don't like for posterior. What I like is 4.0 cores. So this is actually a case that this is my case. So I placed the implant, scanned it, and we milled this custom abutment. I delivered it. It's a 4 core custom abutment. But I wasn't happy with it because we did not have a lot of height or retention of this permanent crown. So we changed it up to a screw retain crown. You can see this is the margin of the abutment, and this is the margin of this abutment, and the height. So there's much more contact to this as opposed to this abutment. So we chose to go with screw retain crowns. And I only do screw retain crowns for these patients whenever they have a really, really tight bite. Right? So this is a 3.3 on a molar. This is a 4.0 on a molar, and this is a 4.8 on a molar. There's various heights and various sizes. I'm highly recommending, if you're using a molar and you can get a screw retain crown with a 4 core, that's going to be in your best interest. Finally, titanium abutments. All right, again, there's going to be 3 core, 3.3 extra easy, 4 core, and 4.8 core. For the posterior bridges, I'm okay with having a 3.3 custom abutment because you're splitting it here. But for singles, split whenever they're individual teeth, I'm always going to use a 4 core or 4.8 core for molars. Why? Because I've had fractures. Again, you have a 3.3. You can see the thin titanium here. I mean, look, you get great bone growth over the implant surface, right? It's incredible bone, right? You would even get bone on top of the implant. I mean, just unbelievable with the system with this connection. However, I want the strength of the abutment because I don't want these things to fracture, and I've had them fracture because you only have 0.65 millimeters of titanium right here and on a molar. It just doesn't work, and I've had these things fracture and they're a pain to get out. So again, this is a 3.3. This is a 4 core. I'll do a 4 core all day long, and this is actually the case. This was in function for about 2 years. He came in and fractured off, so I removed it. I didn't even scan it. I already had a scan for it. I just told him to change the diameter, and so they went from a 3.3 to a 4.8 core, and that's not going to fracture. But again, for bridges, 3.3 cores is fine. For singles in the posterior, you can even order a 4 core. I would never order a 4.8 core in the posterior whenever it's put into a bridge. And this is the different types of screws. So this is the blue 3.3. This is the yellow 4 core, and this is the green. I think this is the 4.8. You can see a side-by-side between the 3 point. So this is a 6.5 diameter implant. This is a 3.3, and this is a 4.0 core. I still like to have platform switching, so I'll use a 4 core, even in second molars. And you can also see that on the X-ray. This is a 4, and this is a 3.3. This is a 4, and a 4.8 would go all the way to this lip. Just the different sizes for posterior. So let's review the platforms of these implants just to kind of drive it home. The internal hex of these are only 2.3 millimeters, right? So then you have your platform, and you also have a bevel. That's for the 3.3, right? The 3.5 millimeter implant, right? And there's all these core sizes and all these platform sizes and all these bevels, right? So the core is actually the diameter of this area, and then the actual implant threads are further out. So this could be like a 3.3 core with a 5 millimeter diameter implant. That's really what you need to tell your lab. You need to tell your lab the core size. Now this is a really good chart. I have this in my office. And we should look. So for the 5 millimeter implant, you can have a 3.3 core, 3.8, a 4, and a 4.3. Now understanding these are the threads, right? So as the core size goes down, you'll get more threads engaging the lateral bone. So softer bone would need that. However, just understand whenever you're using this implant, the limitations. I would never place a 5 millimeter diameter implant with a 3.3 core in the posterior, because you're limited on the abutment selection to restore these cases. I would have placed at least a 4 core or greater in the posterior. It does get confusing because you got a 5 millimeter diameter implant with all these different core sizes. We have some particular core sizes that we use and keep in our office that we use most often. I can get that list to you later on if you need. So the 3.5 millimeter implant has a 2.8 core, and this is the one that you can use for the extra easy. There's all these different heights. And when you get to the 4 core and above, that's when you can start using the 3.3, which is the conventional custom abutment, either tie base or full titanium. 4.5, the 5, 5.5, 6, 6.5, and 7. They have various core sizes and various heights and lengths. So I'm going to drive the core home a little bit more. This is just an implant, and this is the platform. This is how the tie base or the custom abutment sits. So this is a pre-mill. And this is a standard tie gen. So this implant is a 3.3 core, and this is a 3.3 core abutment platform, and this is the screw that holds the abutment in place. All right, now we're going to go from a 3.3, which you see right here. You see that this bevel right here, there's nothing utilized on the bevel. Now we're going to go to 3.3 extra easy. Now this is the extra easy that I showed you. That's a little bit more strength for the 3.5 millimeter implant. You see the bevel helps create, so that this would actually go up from here as opposed to the 3.3 that would go up from here. So that's the difference between the 3.3 and the 3.3 extra easy tie gen. Now when you get into the what they call the medium, or the 4 and the large, which is the 4.8, this is the same fixture, but the platform of this abutment goes further out. So this is still a 3.3 fixture. And just for reference, you're seeing the extent of the tie base. So you can't use this custom abutment or tie base on the 3.5. You would have to upsize to the 4 core fixture, right? So this is the 4 and the 4.8. But now let's look at them on their respective implants. So this is a 4.0 core fixture with a 4.0 core abutment, right? We're not engaging the bevel, but we are engaging the full platform. Now this is a 4.8 fixture with a 4.8 tie gen, which is larger than the 4.0. So again, that they have all these connections for the extra easies, and hopefully this clarifies some things for people with the 4 core, 4.8 core, 3.3, 3.3 extra easy. But understand, whenever you're restoring these implants, it's one scan body, and you can order whatever you want. You can order a 3.3 or all the way up to a 4.0. Your dental assistants need to understand that. Hope this video helps. And again, if you need anything, reach out to me. Happy to help.